All right, let's get right into a fascinating medical mystery. This one's a bit of a thriller, really. It's all about hidden danger, one that's lurking in a place you'd never think to look, inside our own bodies.
So, I want you to picture this. You're young, you're healthy, super active. Maybe you hit the gym, play sports, whatever. And then, just out of the blue, your hand goes cold and pale and weak. What in the world could be going on? It makes absolutely no sense, right?
Well, the culprit here isn't something you hear about every day. It's a rare condition with a mouthful of a name: arterial thoracic outlet syndrome. We'll just call it arterial TOS. And that's what we're going to unpack today, piece by piece. So, let's talk about this dangerous pinch. Now, you should know this type of TOS is actually the least common form. But, and this is a big but, it's also the most serious. It's the one that most often leads a doctor to say, okay, we need to operate. So, what's actually getting squeezed here? To understand this, we have to look at the anatomy, the scene of the crime, if you will. It's this little area called the thoracic outlet. It's this super narrow passageway right between your collarbone and your first rib. I want you to think of it like a super crowded highway tunnel, a major bottleneck, where all the important stuff, nerves, veins, and arteries, have to squeeze through to get down to your arm. Okay, so in arterial TOS, the problem is with the main fuel line to the arm. It's called the subclavian artery, and it's this artery that gets pinched in that crowded little highway. Now, this isn't just a simple squeeze. Over time, that constant compression actually starts to damage the wall of the artery itself, and that's the real danger, because that damage can create blood clots. So you're probably wondering, what causes this? Did you, sleep on your arm wrong? Lift something too heavy? The answer, almost always, is no. It's not about what you did. It's about these little hidden quirks in our anatomy that most of us never even know we have.
And look, the research on this is incredibly clear. This isn't about your lifestyle or some repetitive motion injury. No, in almost every single case, the root cause is a bone abnormality, something structural that a person was born with. And when you break down what these abnormalities are, it gets really interesting. Yeah, you've got a few different possibilities, maybe an oddly shaped first rib or a weird band of tissue. But as you can see, there is one major culprit that's responsible for the lion's share of these cases. I mean, look at that big slice of the pie. And that main suspect, it's something called a cervical rib. It's exactly what it sounds like, an extra rib. Some people are just born with it, and it grows out from the neck. This extra bone basically sets a trap. It shoves that all-important subclavian artery forward and just squeezes it against the first rib and some muscle. And it's that constant day in, day out pinching that ends up damaging the artery wall. Okay, so if the cause is a hidden bone that you can't see or feel, how on earth do doctors figure this out? Well, it takes some serious diagnostic detective work. Back in the day, doctors would rely on these physical tests. They'd have you move your arm in certain ways, and they check your pulse. The problem? Those tests were, kind of useless. They were notoriously unreliable. Get this, they could be positive in up to 57% of totally healthy people. So yeah, not great. Thankfully, today we've got much better tools. Modern imaging gives us the definitive proof we need. So the investigation today follows a really logical path. Step 1 is usually a simple chest x-ray. And why start there? Because a lot of the time, it'll spot that main culprit, the cervical rib, right off the bat. Easy. Step 2 is a duplex ultrasound. That lets doctors actually see the blood flow and check for damage to the artery. But the key, the real game changer, is the final step, the CT angiogram, or CTA. And this is the big aha moment. The CTA scan, especially when they do these amazing 3D reconstructions, gives you this unbelievably clear picture. You can literally see the artery being squished by the bone. All the guesswork is gone. It's the smoking gun that confirms the diagnosis. And even better, it gives the surgeons a perfect roadmap for the fix. So, once you know exactly what the problem is, what's next? Well, fixing it. And the good news is there's a really clear path to recovery. Doctors actually have this brilliant little roadmap they use to guide the treatment. It's called the Scher classification. Basically, it just puts the damage into different stages. So for a stage 1 case, where the damage is minor, the goal is just decompression, relieving that pressure. Simple enough. For stage 2, where things are a bit more serious, maybe there's an aneurysm, they have to decompress and repair the artery.
And then for stage 3, the most serious, they have a 3-step process. First, get the clots out, then decompress, and then repair. See? It's a super logical step-by-step approach. So when it comes to the surgery itself, there are really 3 main goals. Goal number 1, decompress. That just means getting rid of whatever is causing the pressure, like removing that extra rib. Goal 2, repair. You've got to fix the damaged part of the artery so it doesn't cause any more trouble with clots. And goal 3, revascularize. That's a fancy word for restoring blood flow, which means clearing out any clots that have already traveled downstream. All right, so let's just take a step back. We've gone from this really confusing symptom all the way to a hidden cause, a super clear diagnosis, and a very targeted solution. So let's quickly recap the big things to remember about arterial TOS.
The bottom line is this. This is a story about how a tiny, hidden quirk in our own anatomy can cause some really serious problems. But it's also a pretty amazing story about modern medicine, right? How a really clear diagnostic path and a very specific surgery can lead to excellent, excellent outcomes.
And speaking of outcomes, the results really do speak for themselves. Look at this number, because this is the one that really matters. Over 90%. That's how many patients say their symptoms are completely gone after surgery. That is an incredibly high success rate. It just goes to show that when you fix the problem at its source, it works. It's just such a powerful reminder, that even with all our technology, our own bodies still hold these fascinating secrets. It really makes you wonder, doesn't it? What other secrets is our anatomy hiding from us right there in plain sight?